approaching the 4-month mark of the WGA strike.
And some industry workers from a variety of unions could start losing their health insurance if they don't meet minimum income or hourly requirements. On your sides, Christine Lazar is here now to explain. And we knew we were going to see the ripple effects of this weeks and months down the road.
Yeah, it's tough because these workers want to honor the picket line. They believe in what they're striking for, but at the same time, they also want to protect themselves and their families. You know, a lot of them have their entire family on the health plan, and they're very good health plans. So it can be really tough if they're in jeopardy of losing that. So the health care offered by the unions, it's only available to those who are consistently. And with the WGA and SAG-AFTRA strike ongoing, as we mentioned, nearly 4 months now, some union members are worried they will not qualify for continued health coverage, including one crew member whose son just had brain surgery.
It's been, I think, the most stressful thing of my life.
Even as someone who practices daily meditation, Kurt Darling is finding it hard to keep calm.
Oh my God, it's been so overwhelming.
2 weeks ago, his 13-year-old son, Jameson, underwent brain surgery for a structural defect with his skull and spine.
The brain can slide down into the spinal area where it shouldn't be. And so in this case, surgery is required where they literally have to cut into the skull, lift up the brain, get it in place.
Darling is an on-set hairstylist, even winning an Emmy for his work on General Hospital. He was working right up until the strike, but his health insurance through the motion picture industry health plan is set to expire in November, and he is 69 hours short of work for coverage to continue.
It wouldn't take much. You know, I'm used to working 12 and 14-hour days, and so a week's work would cover it.
WGA writers must earn about $41,000 in union work per year to keep their coverage. SAG-AFTRA members must earn at least $26,000. Kurt's wife, Connie, is an independent contractor, so without his insurance, their family of 4 will be uncovered if he doesn't get more hours in the next 2 months. And while he won't cross the picket line, he is looking for work that is allowed by the union at a much lower pay.
I'm willing to work for the lower tier stuff or the micro budget, whatever it is that I can get my hours, make sure that my family are covered.
The motion picture industry health plan is offering extra credited hours, but they don't apply to Darling. Darling's union, IATSE, has called on studios to fully fund health care for crew members, as they did at the start of the pandemic. And I did reach out to both SAG-AFTRA and the WGA. The WGA did not get back to me, but SAG-AFTRA's health plan, they just added a notice to its website that it's added a 3-month extension for qualifying participants so they don't lose their health insurance due to lost wages during the strike. And what people don't realize is that, first of all, like the man I interviewed, he doesn't want to cross the picket line. But even if he did outside work, you know, working in a salon, that's not going to go towards his credited hours he needs for his health insurance. So it's very specific work that he needs to do. He's hoping to just find something with a waiver, or, you know, they have the ultra low budget, the micro budgets they can still do. Really, if he got a week of work, he would qualify for health insurance for the rest of the year, and that way his son and his family would be covered.
I can't imagine the stress he's going through,
Yeah,
just trying to stay afloat, really.
Yeah, I mean, you have a child who's sick, and then you have this as well. So anybody out there, if you need a hairstylist, he's amazing, he's wonderful, he'll do yoga on set too. And that way you also know you're helping a family, you know, right here in LA who needs it.
It's so hard to hear about.
Yeah.
Thank you.
Yeah.